Welcome to Pharma. Please don't forget to subscribe to my channel and make sure you like and share this video with your friends. Obesity is not just a cosmetic concern, it's a complex medical condition that can affect overall health and quality of life. According to World Health Organization, overweight and obesity are defined as abnormal or excessive fat accumulation that presents a risk to health. Most often, obesity is caused by dietary excess and increasing trends of eating out, like fast food. Physical inactivity and sedentary lifestyle is another major contributor of obesity. It is rarely caused by genes and usually appears during childhood. Abnormal genes are affecting the appetite, leading to consistent overeating. Obesity is the result of an imbalance between energy intake and energy output. If the caloric intake is more than energy expenditure, then weight gain will result. Drugs may also contribute to obesity. These drugs include Phytofen, atypical antipsychotics like olanzapine, antidepressants like SRIs, tricyclic antidepressants, mirtazapine, and monoamine oxidase inhibitors, anticonvulsants like phenytoin and sodium valproate, lithium sulfonylureas like gliclazide, glimepiride, insulin, corticosteroids like dexamethasone and prednisolone, antihistamines, especially older agents like cyproheptadine. Obesity affects the body in many ways. It can cause metabolic changes that increase the risk of serious diseases. Most common implications of obesity involve increasing the risk of stroke development, increasing the risk of atherosclerosis development, which is plaque buildup. Plaque consists of cholesterol, fats, and other substances that accumulate and build up in the artery wall, and this will cause the arteries to become narrowed, and thereby the blood flow will get reduced. Over time, the plaque gets ruptured and blood clots start to form. When atherosclerosis is formed in the arteries of the heart, this will lead to atherosclerotic cardiovascular diseases like coronary artery disease. Other complications affecting the heart include diastolic heart failure and obesity cardiomyopathy. Extra fat tissues can cause inflammation, which in turn impair insulin signaling, and thereby the insulin receptors in fat cell surface become less responsive to insulin, which means fat tissues cannot uptake any more glucose from the blood. Glucose remains and accumulates in the blood, and this ultimately leads to diabetes. Extra fat can also build up inside the liver, causing non-alcoholic fatty liver disease. Over time, if left untreated, the liver gets inflamed and damaged, leading to cirrhosis. High blood glucose level can damage the kidney as well, leading to diabetic nephropathy and, in the long term, chronic kidney disease. Being obese puts extra pressure on knees, leading to knee damage and inflammation, and thereby will result in osteoarthritis development. For those who are already diagnosed with osteoarthritis, obesity and overweight will increase the severity of symptoms and the progression of the disease. For the diagnosis of obesity, body mass index is often used as a measure of body fat and is calculated by dividing body weight over the squared height. Those with BMI greater than 30 are considered to be obese. BMI is not an ideal measure of body fat, and there are some limitations to its use. For example, bodybuilders may have higher BMI despite minimal fat deposits. Older people have high body fats and minimal lean muscles. Thereby, their calculated BMI will end up to be lower despite increased body fat deposits. BMI measure is also inappropriate in children and in pregnant women. Waist circumference is the measurement of abdominal body fat. It is measured midway between the bottom of rib and slightly above the belly button using stretch-resistant tape. People with abdominal obesity have higher risk of developing cardiometabolic diseases. Cardiometabolic risk is increased when the measured waist circumference is above 94 centimeters in men and 80 centimeters in women. Cardiometabolic risk is substantially increased when the waist circumference is above 102 centimeters in men and 88 centimeters in women.